we'll study the subdivision of anatomy, like we have previously discussed, right? So anatomy has subdivisions like gross anatomy, also called as topographical anatomy. It's also called as topographical anatomy, and it's overall macroscopic anatomy. Macroscopically, we'll see, right? So it's regional and systemic. So as I have already said that we study in a regional way, not systemic way. So like head and neck, thorax, abdomen, and pelvis, like upper limb, lower limb. So we'll study in the regional anatomy, regional way, not in a systemic. Systemic way we'll learn in a clinical approach, clinical practice also, and further upcoming years, like in your PGs and super specialization, you will study in the super systemic anatomy. Second is the microscopic anatomy. It's also called as histology in the general term, like histology means tissues, right? So the third is the surface anatomy. It's also called as topographic anatomy. The fourth is the comparative anatomy. The fifth is the physical anthropology, also called as biological anthropology. Sixth is the living anatomy. Seventh is the clinical anatomy. Eighth is the radiological anatomy. Ninth is the developmental anatomy, also called as embryology. 10th is genetics. 11th is experimental anatomy. So generally we study like this. So it's general anatomy, gross anatomy, neuroanatomy, embryology, histology. In general anatomy, it will be radiological anatomy, surface anatomy, genetics. In gross anatomy, this is very much important. Like we'll be having volumes of books that we have to read. As students, you have to read. There will be volumes of books. Like regional approach is the most practiced, most studied. So that like head and neck, one volume, head and neck, brain separately, thorax, abdomen and pelvis separately, limbs like upper limb and lower limb extremities, like, and the neuroanatomy, embryology, histology. You'll study like this in a systematic approach. So if you take gross anatomy, it is a study of anatomy on cadavers by dissection and observation of structures by naked eye. To naked eye, you are able to see those structures like physical, like okay, this is the structure, you can feel it. So this is gross anatomy. So the gross anatomy structures, like we'll study in the regional anatomy, system wise systemic anatomy. In the region wise regional anatomy, we'll have head and neck, brain, thorax, abdomen, pelvis, upper limb, lower limb. In the systemic anatomy that we'll see now, like integumentary system, like skin system, like we'll study of the skin and functions, skeletal system, articular system, muscular system. These three comprise locomotor system, right? Skeleton and muscle and joints on, we will able to walk, we'll be able to have movements. And the nervous system, cardiovascular system, lymphatic system, endocrine system, digestive system, respiratory system, reproductive system, and urinary system. So these endocrine, digestive, respiratory, reproductive, urinary is called as planktology. So we'll get to know. In gross anatomy, the structures are studied either regional wise and system wise, we have already discussed. So in the regional anatomy, all the structures in a particular region of the body are studied at the same time. Body region was dissected. The several systems located in the particular region of the body, right? I have already said the several systems that are in the particular region, like for example upper limb, the nervous system, the blood vascular system, the muscular system, and the skeletal system. Everything in the upper limb will study at a time. So this is called regional approach of anatomy. So this will be very useful for the clinicians, especially surgeons. So like for example, see this illustration. The body is divided into 6 regions that's how we study: head and neck, brain, thorax, abdomen, pelvis, upper limb and lower limb. And the systemic approach and the systemic anatomy, in this systemic approach, all the structures forming a particular system are studied together at this time. Like only particular system we will study, like nervous system, whole through the body, the nervous system itself will study. The muscular system, whole through the body, the muscular system itself will study. Like blood vascular system, the whole in the whole body, the blood vascular system itself will study. Like systemic approach, not included in many systems, only single system that will study in depth. So for example, if you see the organ 1, organ 2, organ 3, many organs comprise to form a system, right? Organ system. So what are the common functions of all these organs are there, we'll study as a system wise. So in this systemic anatomy, the study of one system at a time. So we have already discussed. Systemic anatomy provides comprehensive knowledge of a particular organ system throughout the body. Throughout the body, particular system, about the particular system, it will give a knowledge of in a comprehensive way. So useful for physicians. Physicians, generally physicians, it helps physicians more, like neurophysicians. They'll study more about the nerve system itself, right? And their what that nerve system do to the other systems. So it will be useful for them. So if you see this illustration, in human body, what are the systems that we have already dealt that are there in this also. So if you see integumentary system, the study of skin and its appendages; the skeletal system, the study of bones; the articular system, the study of joints. It's also called as arthrology or syndesmology. The muscular system, the study of muscles; nervous system, the study of neural tissue; and the cardiovascular system, the study of heart associated blood vessels; the lymphatic system, and the study of that's another one, the study of lymphoid tissue and lymphatic lymph vessels; the endocrine system, the study of ductless glands, endocrine glands; the digestive system, the study of structures concerned with the digestion, all the structures like stomach, intestines, everything; and the respiratory system, the study of structures concerned with the respiration; the reproductive system, the study of structures concerned with the reproduction like genitalia and everything, accessory glands, everything. So urinary system, the study of structures concerned with the formation and disposal of the urine from the body, everything. If you see, the microscopic anatomy is nothing but histology. It is the study of body structures with the help of microscope. Yes, microscopically we can't see with our naked eye, right? So we will need the help of microscope. So body structures, like we see, and this histology also will be having normal and abnormal. Normally we can see like normal structures we know, but abnormal thing that we'll study in the pathological aspect of the tissues, like what had happened that lead to its disease. So we'll study that also under microscope. So this is very much helpful. So the instrument that is used is microscope. There are many microscopes: simple microscope, compound microscope, electron microscope. But what we use is like compound microscope. Like in that compound microscope, there will be many types like bright field microscope, dark field microscope, phase contrast microscope, interference microscope, polarized light microscope, fluorescence microscope. That you in depth you don't need, just what does it show, that only you'll need this. So if you study that compound microscope, a compound microscope may also be referred to as biological microscope, because we will see the biological tissues, right? The compound microscope in laboratories, what general medical schools, medical colleges will have is this compound microscope itself. In laboratories, histology and pathology labs, you'll find the samples viewed under a compound microscope must be prepared on a microscope slides. Yes, on slides, prepared slides or ready-made slides there will be. So by that you will study about the anatomy, about the tissues basically. Using a cover slip to flatten the sample, slide preparation process there will be. So the compound microscope can be used to view variety of samples, like blood cells, bacteria, parasites, algae, tissues, thin sections of organs. Like these blood cells, bacteria, parasites, algae, tissues, you will be studying the microbiology also. But the abnormal things you will study in pathology, and the normal things you will study, of course, in the physiology itself. So the thin sections of organs for diagnosis pathology, this is very important. So first of all, you know about the parts of the microscope. Like it will be having eyepiece, like ocular lens, and stage, and the where you keep the slide, and the like magnification, coarse magnification, and fine adjustment. You'll be having light also for viewing polarization. So you'll be having light. So you should know about the eyepiece lens and ocular lens. You should know with the microscope parts also. So the magnification of the microscope is like 4x, 10x, 40x, and 100x. That lens will have this magnification. Objective magnification is called as. So multiply it into 10, 10, 10, 10 eyepiece magnification. It will be 40, 100x, like 40, 100, 400,000 overall magnification. So microscopic anatomy provides structural detail of tissues and cells which otherwise are not visible to the naked eye. In the microscopic anatomy, histology, like in the UG curriculum, we'll study the following tissues like cells, simple epithelia, stratified epithelia, connective tissues, and bone, cartilage. Those microscopic structures of these organs and tissues, muscle and nerve tissue, the cardiovascular system, and the lymphoid tissue. So in the simple epithelium, epithelial layers, so we'll see simple squamous epithelium, simple cuboidal epithelium, simple columnar epithelium, and the stratified epithelium we'll see stratified cuboidal epithelium, stratified columnar epithelium, stratified squamous keratinized epithelium, stratified squamous non-keratinized epithelium, pseudostratified ciliated columnar epithelium, and transitional epithelium. We'll study like where these epithelia are located, on which organs, on which structures they are located, and what are the functions of this also we'll study. Connective tissue, like embryonic connective tissue, loose areolar connective tissue, adipose tissue, the reticular connective tissue, dense regular connective tissue, the dense irregular connective tissue, the bone. These the bone cartilage are the specialized connective tissue, as we already know. Like bone, microscopic structure of bone also we will study. Like TS, transverse section of compact bone, Iverson systems, everything we'll study. The LS, longitudinal section of the compact bone, the cartilage, like types of cartilage we'll already get to know we'll get to know in this. So the in histology also we'll get to know the microscopic structures, like in depth what is the microscopic structure of the cartilage will get to know, like hyaline cartilage, white fibrocartilage, elastic cartilage. What is composition, what are they made up of, like we'll get to know what are they made up of through this microscopic anatomy. The muscles, so muscles will know the skeletal muscle, longitudinal section and transverse section of skeletal muscles, like muscle fibers. We'll get to know everything, nucleus and their nucleus and everything, sarcoplasmic reticulum, everything we'll get to know in the microscopic structure. And the smooth muscle cells, like longitudinal and transverse section muscles, and cardiac muscle, we'll get to know gap junctions, how they are arranged, we'll get to know about that in the microscopic study. And the nervous tissue, this is very important, like peripheral nerve, how long-term section of a peripheral nerve will look like, what are its significance, what are axons, like we'll get to know everything. Peripheral nerve and transverse section, views, different views, transverse and longitudinal disease. So spinal ganglion, how the axons are arranged, cell bodies are arranged, we'll get to know. Sympathetic ganglion. And the cardiovascular system, if you look at the cardiovascular system, like large arteries, like aorta example, we'll be seeing like how like lumen and the cells that are arranged, and how many layers of cells that are arranged, we'll get to know. The medium-sized or muscular artery, large vein or medium-sized vein, every anatomy of these veins and these blood vessels, everything we'll get to know in the histology. We'll study in the histology. So if you look at cardiovascular system also we'll study. And the lymphoid tissue, lymphoid system, like lymphatic system, lymphoid tissue we'll study the lymph node. This is very important. Lymph node microscopic anatomy, spleen and thymus, these are all lymphoid organs, right? So the thymus and the palatine tonsils. So we will learn the microscopic arrangement structure of cells in these organs also. So that will be in detail dealt in the histology, that is separate anatomical subdivision. So we'll study. And the respiratory system, like trachea, lung and epiglottis, bronchus, bronchiole, all these microscopic structures we'll study as in of like respiratory system, that included in the histology we'll study. And the skin, as I already said in the starting of the thick skin, thin skin, where they are located and what's the layers of this and what is the significance of these, and like cellular arrangements we'll study. And the salivary glands, like parotid glands, submandibular, sublingual glands, what are the predominant cells in these glands, we'll study. So those secretions, how they are secreted in the ductules, like everything we'll get to know in the microscopic structure. By that it will be a very useful for as a doctor, as a becoming doctor, you'll know what are the abnormalities that will happen if you study normal things. The abnormal things automatically you'll get to know. So we'll learn in this histology normal things, normal structures, and in the pathology we'll study abnormal structures, so that how the cells are inflamed, how the cells are like changed, transformed, metaplasia, what is metaplasia, how they are transformed, so that the condition of the disease progressing, so we'll get to act according to the diagnosis. So this is the what a microscopic anatomy helps you. And if you see digestive system, so tongue, if you see tongue, like what are the papillae on the tongue, and the microscopic structures, how the cells are arranged, so you'll get to know. Tongue with circumvallate papillae, you will get to know. Will show actually the you will be having records also. Records, you have to draw these histological diagrams by your own hands with the like hematoxylin and eosin pencils. So how, if you know these concepts, you'll get easy to draw them. So I will show that drawings also. I will show drawings also in the histology like subunit. I will show. So the digestive system included the esophagus, stomach, fundus region, and like stomach also various region, fundus, pylorus. So where the arrangement is different. So we'll study fundus region, stomach of the stomach, and the pylorus of the stomach, that microscopic anatomy, and the duodenum. This is a small intestine, right? The maximum absorption takes place in small intestine. So we have to study the layers of the small intestines in depth. So duodenum, jejunum, ileum, the appendix. So appendix you should know, because appendicitis. So if there is inflammation, if there is a disease progressing in the appendix, so if you study normal things only, the inflamed cells or the infected cells of the appendix, you will get to know, and you will plan for a surgery, or you'll tell the patient that your cells are inflamed, like you have to do a surgery to remove it, or you have to necessary prophylaxis you will take. So large intestine, liver, liver is the like it's the major organ, right? So you should know what are the cells, hepatocytes, what are the cells that are arranged, like bile, how bile is transported from that, how it is stored, the gallbladder, pancreas, how insulin released, how pancreatic enzymes are released, what are the cells that are there in these organs, you should know. So by microscopic anatomy you'll get to know everything. And if you know the structures and their secretions and functions, you'll know about that overall organ, what it does to your body. So the urinary system, like kidney, ureter, and urinary bladder, and the kidney, that is more is a critical organ, right, for your urine formation and elimination of waste from your body. So you have to know about the renal calcium, what are the cells that are there in the kidneys, what is a nephron, like you have to know microscopically. And endocrine glands, like thyroid gland, thyroid follicles, you should know how the T3 and T4 hormones are produced, right? So tetrathyroidonin, triiodothyronine, you should know how they are secreted, what pathology happens to the organ, what happens if the pathology, this is condition occur to thyroid, like parathyroid glands, parathormones, the pituitary gland, master endocrine gland, the suprarenal gland. You should know the microscope stuff of these organs also, these glands also, right? So the male reproductive organs, testis, epididymis, vas deferens, seminal vesicles, prostate gland, right? Female reproductive organs, ovary, fallopian tube, uterus, mammary glands, placenta, umbilical cord. If you know these microscopic structures only, you will get to know further subjects. Like these are preclinical subjects, right? So preclinical subjects, if you learn these only, it will be very much useful in a clinical subjects. Like if you know about the fallopian tube, ovary and uterus and mammary glands, it will be obviously useful in your obsgyny, right? Obsgyny. It will be helpful in your obsgyny. If you study in endocrine glands, it will be very much useful in your medicine, right? Digestive system, everything is interlinked. So you should learn everything, right? And the central nervous system is very much important. If you become a neurosurgeon or surgeon, like it will be very useful. Spinal cord, transverse section of a spinal cord, you should know the microscopically how it is arranged, what is that, you should know. And the cerebellum, you should know. Neurons, how they are, how cell bodies and their axons are located in the brain, you should know, you have to know. And the special sensory organs, like cornea, there are 5 layers of cornea, because it will be useful in a cornea transplant surgery, like cornea transplantations, it will be useful. And retina, how you are able to see the things because of the retina, right? So what are the layers of the retina, you should know. So this is the histological subdivision. So if you come to surface anatomy, it is a study of the relationship of deeper structures with the skin surface. Actually, in the previous videos we have, for example, that we studied about that how if a bone is fractured, what is, if a nerve is curted, what is. In a diagram we studied, no. So deeper structures, first the skin, afterwards superficial fascia, deep fascia comprising oral fascia, afterwards blood vessels, nerves, muscles, bones. So we have studied, right? So it is a structure of deeper structures with the skin surface. So surface anatomy can be seen, it can be seen, right? Palpated on the body surface. This is very important. You can palpate your tendons, right? You can palpate the veins, right? See, you can palpate your veins, right? See, you can palpate your skin, right? So under structures like veins, you can palpate the bone also, right? Joints also, right? So can be seen, palpated on the body surface. In the surface landmarks, they serve as a surface landmarks for deeper structures, like undergoing any examination, anything. You will get to know the surface landmarks, and any incisions that were made on the body, you'll know about that surface anatomy, and like where liver located and the Langerhans lines, the divisions of the abdominal divisions, there will be Langerhans lines that will be divided longitudinally and transversely. So look at the various organs and where we have to incise, so it will be helpful in that. This method can be used both on the cadavers and on the living individuals. Can be learned using cadavers as well as living individuals. Learned in the cadavers and performed in the living individuals during any surgery or any markings, any examinations, it will be very useful. And the main objective of the surface anatomy is visualization of structures that lie beneath the skin. Yes, of course, you will mark everything. So okay, this organ is like this organ is supposed to be here. So from here to this one organ to one organ, how much space is there, what are the organs that are involved. So you'll get to know about the surface anatomy. And the surface anatomy basis for physical examination and surgical importance. Yes, it's very important in surgical procedures. It's very important. Example: surface anatomy of upper limb and lower limb, surface anatomy of abdomen and pelvis, surface anatomy of bones. Bone surface markings are very important. You'll be asked, of course, you'll be asked in your practical examinations, like where is McBurney's point, and where is terion. So like that surface markings you are asked on the bones, skull bones and your long bones. So locations, landmarks, you will be asked. So it will be helpful if you learn. And if you see, fourth is the comparative anatomy. It is the study of changes in the form, structure, function, like different parts of the body, like animal kingdom. Something like evolution, from where the evolution happened. What are the structural changes of the bones that are happened, like from crawling to we came up like slightly slightly bending to of like 4-leg walking to we have came on 2-leg walking, like Cro-Magnon man, that evolution process. So how the gradual drastic changes that have happened in the bodily structures that are studied in the comparative anatomy. And physical anthropology. In physical anthropology, the study of the physical characteristics of human beings and their ancestors. Nothing but comparatively, but it is like variability of these characters among the different racial groups, different groups that are studied, that anatomy of the body is studied in the physical anthropology. It is importance, like its importance in the knowledge of physical anthropology helps to solve medico-legal problems of the identification of individuals. Of course, physically, like two different racial groups are different, right? In a region wise they are different, right? So that is structural study is a physical anthropology. And living anatomy, this is very important. If you see, this is very important. The study of the structures of the bodies of the living humans by inspection, palpation, percussion and auscultation. Remember these terms throughout your medical career. This will be very, very, very important throughout your medical career, like with the help of various medical procedures, bronchoscopy, gastroscopy, cytoscopy and various imaging techniques. So I was saying that remember these: inspection, palpation, percussion and auscultations. These will be very much useful in your clinical practice. So we'll study what is inspection: visual observation, examination, no touching of the subject. The subject here is the patient. You will not touch the patient, but you will examine through your visualizations what the changes that the patient undergone. on externally. So the palpation, feeling the body of the subject patient with the hands. By touching the patient, you will get to know the examination of the body of the patient. So it is the palpation. Example, feeling the radial pulse with your fingers by approximately holding the topographic area where it can be felt near the wrist, like this. You will be holding, you will be like this place, and you will feel the radial pulse. So this is the way. So it's a palpation. For example, I have shown the example. Palpation can be many types. Okay. So percussion, by tapping the surface of the body part with the middle finger. So you take the 3 fingers. The third finger you'll keep on the surface, like suppose abdomen. You'll percuss. From this you'll get to sound like diagnostic sounds, like what is the content in it. In abdomen, for example in the abdomen. So if any fluid accumulation happened in the abdomen, you'll get to know by the percussion, right? If you beat here, the waves from this bone will travel to the fluid. If there is a fluid or any gassy like matter, so you'll get the different dull sounds or notes. So it will help by tapping the surface of the body part with the middle finger of one hand on middle finger of the other hand that was kept in contact with the body surface. Interpretation is by resulting sound, that is resonant note or a dull note. Example, pleural effusion, like collection of fluid in the lungs, or abdominal ascites, fluid accumulation in the abdomen, ascites, like can be identified. And this is the auscultation. Listening to the sounds arising within the organs by using stethoscope. So by using stethoscope, placing on the surface of that region, you will be able to listen the sounds producing from the organs or the surrounding regions. This aids in a diagnosis and treatment. For example, cardiac auscultations, you will hear heart sounds, right? So those are cardiac auscultations. And bronchovesicular, pulmonary auscultations, like breath sounds you will hear, and the bowel sounds you will hear. And then stand example, etc. You'll listen the bowel sounds. So this is auscultation. If you come to clinical anatomy or applied anatomy, this is very, very, very useful in your clinical practice. Application of anatomical knowledge in the clinical practice. Example, diagnosis, treatment of the patient, medical or surgical methods, it will be useful. And the clinical anatomy covers application. Like you'll get to know, you'll have a clinical application in the subject that you study, like gross anatomy, developmental anatomy, histological anatomy, neuroanatomy. You will have certain clinical boxes like clinical anatomy, that is very useful. This branch is the practical aspect of human anatomy and is of supreme importance for medical professionals. Example, clinical anatomy, upper limb, like joints, muscles, nerves. Wherever the clinical application is there in aspects that will be discussed in textbooks, like glenohumeral dislocations, shoulder dislocations, and subacromial bursitis, inflammations of bursa, like olecranon bursitis, tennis elbow, lateral epicondylitis, like golfer elbow, radial subluxation. Like if it comes in muscles, it's intramuscular injection site, where like clinical practice, right? Clinically you will mark a point and you will give the injection, right? So rotator cuff tear and ruptured supraspinatus and nerves, like if I already told, if any damage or compression to the nerves causes paralysis or etc. So like damage to that organ or specified part that nerve supplies, like winging of scapula, injury to the long thoracic nerve, paralysis of serratus anterior, and suprascapular nerve entrapment, and Erb's palsy, Erb's distant palsy, like axillary nerve damage, radial nerve damage, ulnar nerve damage, median nerve damage. So it will be very helpful clinically. I will discuss like radiological anatomy. So it will be very useful in radiology. That it will come in the final year. Of course, it's a separate branch that is made out radiology. Like it's very important in diagnosis certain diseases and everything. Like it is the radiographic visualization of structures and their relations with neighboring structures inside the body using X-rays, ionizing rays. Somewhat these are, of course, these are harmful, but to diagnose anything, it's very useful nowadays. It's a revolution, you can say. And magnetic field and radio waves. So by using X-rays, magnetic field, magnetic and radio waves are like, they are non-invasive, like non-invasive Yet they are used currently, but they are of high cost. If you use MRI like that, it will be high cost. But using X-rays, magnetic field, and radio waves, you can radiologically imprint the anatomy, and you can study. With advancements in medicine, it's possible to visualize internal structures in a living individuals without opening the body. Without opening the body, you can visualize. This is the most helpful thing that can get to a patient, right? Without opening body, you can visualize the patient's diseases, very like organs and tissues, everything. Various parts of the body and organ systems can be visualized by X-rays, sound, ultrasound, and a CT, computed tomography, MRI, magnetic resonance imaging using magnetic field, bronchoscopy, and intravenous radiography, etc., etc. Our inventions are made so for understanding normal appearance in the health and for identifying the abnormalities in diseases, it will be useful. Recently, new imaging techniques like CAT or CT scan, computerized axial tomography, MRI, magnetic resonance imaging, ultrasonography scans, these are frequently used to study deeper structures with great accuracy with little or no harm effects. Note. Sound enabling knowledge is required for performing the technique and for interpretation of the structures visualized. So that's why radiology is a separate branch, like it's a separate specialization that you can uh, try for that. And now here comes is the developmental anatomy or embryology. It's also called as embryology. It is a study of the intrauterine development of an individual, which begins with the fertilization and ends the birth. Like events, the fertilization to the birth, the development of the fetus is the developmental anatomy. So it is study of early development stages of an organisms. You will study at which weeks, like what are the weeks that are like gestation period, what are the weeks, what is the development of the fetus, what can be the abnormalities. First of all, what can be the abnormalities at the different trimesters or divided weeks. So how to correct it, how, what happens, what is the organ developed, what are the structures at which trimester they are developed. So those all are discussed in the embryology. Again, this is very useful in the obsgyny, obstetrics and gynecology. It is very useful. So like importance is knowledge of embryology provides basis of certain clinical conditions resulted from error during early developmental period of organisms, which can be corrected. If not, which can be avoided also. If it is a new syndromes or anything that you can that will that are resulted. So provide the basis for the location and relations of structures. Example, location and relation of, like example, heart, liver, stomach, spleen, kidney, their developments. Possibly development of the heart, development of the liver, development of the stomach, development of the spleen, development of the kidneys, etc. So the stages of development, like embryonic development, fetal development, and a postnatal development is also included in the embryology. So the genetics, if you come to the genetics, we all know, we all study in the lower classes, the study of the heredity, the process of transmission of the genes that are characters or traits from parent to offspring and associated variations. Can we play a role in the causation of defects or diseases? Of course, diseases or the defects or syndromes can be passed from the familial, right? So the study of principles of heredity and variations. If you see genetic disorders, like it can be chromosomal disorders or multifactorial disorders or monogenic disorders. Like chromosomal disorders, it can be Down syndrome or trisomy 21. We all know that, like Klinefelter syndrome, Turner syndrome, Edwards syndrome, Patau syndrome, like, or multifactorial disorders like Alzheimer's disease, arthritis, cancers, CAD, coronary artery diseases, and diabetes like CHD, congenital heart defects, or monogenic disorders like cystic fibrosis, right? DMD, Duchenne muscular dystrophy, familial hypercholesterolemia, and sickle cell disease, and discharge disease. Like many diseases, you will get to learn like how they are, how these traits, how these genes are passing from one progeny to the other, from the father to the younger ones. So this can be studied. The next is the experimental anatomy. It is the study of the factors that influence and determine form, structure, and function of different parts of the body, like various experiments, through various experiments. Example, demonstration of sites of valves in the veins, applying tourniquet, like in the upper arm. In the upper arm, see, this is the upper arm, right? In the upper arm, will tie tourniquet and will tightly fist up. So you can see the veins, right? So their walls, so the vein, you can demonstrate the site of walls in the veins, like the propulsion of blood, how they are involved. So determining the direction of blood flow in the vessels can be demonstrated by certain experiments. Through those experiments we can learn the anatomy, that is the experimental anatomy.